Thank you for sticking around. The conversation is still going on. Again, we are on prostate cancer with Dr. Paul Bakowa, all the way from ADDY Memorial Hospital. That is in Kanyanya along Bahai Road. I keep on telling myself, Kanyanya. But yeah, earlier on, you told us that especially the men above 60 and above, right? But then you say that does not negate the fact that even when you're younger, you could be affected by this. So when should men start going for screening?
So about prostate cancer screening, as with everything in medicine, we have our protocols. So, but generally we advise from 45,
Okay.
From around age 45, you start going for prostate cancer screening.
Okay.
And when we talk about prostate cancer screening, mainly we are talking about two tests. First, the examination, the physical examination, and for prostate cancer, for the prostate, it's what we call a digital rectal exam. And then the biochemical test, so the blood test, what we call the prostate-specific antigen. Those are the two major tests that we use during screening. So for men from around 45 up to 75, we do advise to come for screening.
Okay.
Now, how often you come for screening is going to depend on your PSA levels. So if your PSA levels are between 1 and 2, then we say come every 3 years, every 2 to 3 years.
I was reading about PSA. What is that exactly in nursery school English?
So, as the name suggests, prostate-specific antigen. So antigens, these are markers.
Yes.
They are markers. Now, this marker is going to be specifically produced by the cells of the prostate.
Okay.
Now, as I had told you, as I alluded to earlier, that during prostate cancer, you're going to have the cells proliferating more than they are being killed off.
Okay.
So because they are proliferating at a higher rate, they are going to be producing this marker at a higher rate. So if you find this marker higher than in the normal ranges, then that is telling you something abnormal is going on with the prostate. So the higher the levels, so there is no level that you say this cutoff, below this cutoff you are free from prostate cancer.
Yeah, you're good.
No, there is no level at that. Even a person below 1 may still be at risk of prostate cancer. However, the higher the level of PSA, the higher the chances or the higher our suspicion is for severe prostate.
Okay.
Yes.
Now, given where you said it's ideally located, how are you going to make the test again? Isn't there? Isn't painful? How? I'm wondering, how do you get there? Because if it affects that thing, ideal. So how do you get in there?
So the way the anatomy of the prostate is, if you come to that lower area in the pelvic region for gentlemen, is that so you have your urethra moving like this. Right? It moves in an L, a weird L-shaped form. But where the prostate is, just behind it, is what we call the rectum.
Okay.
So you can access or you can feel for the prostate, the posterior aspect, the back part, the back side of the prostate, from the front side of the rectum, which we call the digital rectal exam. So the healthcare practitioner will tell the gentleman, lay on your side, and then you make one leg straight and you bend the other, you flex it at the hip.
Okay. Yeah.
And then they will access through the rectum.
Yes.
And they will feel for the prostate. What they are feeling for first and foremost its size. They are feeling for its consistency. They are also feeling for so the lining, what we call the mucosa of the rectum above the prostate should be free, should be mobile.
Okay.
But the moment you are having an invasive tumor, or if the cancer has progressed, it's going to stick to the mucosa. So the mucosa is going to it's not going to be mobile. So they will also feel for that. So that is what we call the digital rectal examination.
Okay. Wow. It feels painful. And knowing men, they do not like pain.
It is an invasive
Yeah.
Exactly.
Haven't you had issues where men are not willing to come in because of the pain that could come out of it?
Actually, it is one of, so most times when a gentleman comes up to you and you explain to them and you tell them the purpose of the test you are doing,
Yeah.
some are uncomfortable with it because it is an uncomfortable test. I do not speak to it in a personal manner, but from the times I've done the examinations, it's more uncomfortable than it is painful. Yes.
Okay. Now, are there issues with, because again, when we are talking about the anatomy of the man, the concern always has to be with whether they can be able to, or even to give birth. So does this cancer affect any of those two?
So, as with, so for the side of, one of the complications, let me start with that. One of the complications of CA prostate is what we call erectile dysfunction. So, you may get issues with either initiating the erection or maintaining the erection, if you can initiate the erection.
Okay.
Now, that is one of the main complications of CA prostate. Because of, as it will spread and affect almost everything, especially the invasive one, the one that has spread. It will spread and affect almost everything. Up to, it will actually, it can spread up to the bone and the brain. That is for the metastatic type. Then, for infertility, remember, when the sperm is being carried from the testicles, it's going to go through what we call the seminal, it goes through some channels. And they do come up and penetrate through the prostate. From the prostate, through the prostate, into the urethra.
Yeah.
So if there is overgrowth in the prostate, and there is obstruction in the prostate, you will have some complications in fertility condition. And also do remember that the prostate releases seminal fluid. Seminal fluid is alkaline in nature to negate the acidity of the women's side.
Yeah.
So if there is also a problem in production of seminal fluid, you are going to have problems because most of the sperm doesn't do well in acidic media. So if it does go and there is no
alkaline to balance it
out, so that is how we get some of these problems.
Ah, okay. Now, is it something that can be treated? And if so, are there numbers or cases where you've seen people that fight it are most likely to beat it than lose?
Yes. So, the good thing with most solid tumors, so solid tumors, I mean any tumor that literally can feel. Good thing with most solid tumors, if caught early, because their definitive management is surgical. So if a solid tumor is caught early, that's why we actually ask for screening. That's why we are really for screening, primary health care. If a solid tumor is caught early, it can be resected. If it's still localized in the prostate, it can be resected, what we call a prostatectomy in this case. You take out the prostate, and then you have taken out the tumor. So you will have your surgical management, but we do combine surgical management with chemotherapy. So you take out the prostate, that is if it is localized, take out the prostate, then start your chemotherapy.
Right.
And then you monitor how the PSA levels are responding.
Can it be, is it, how do they call it? Again, can it be transferred to your family if at all any of your parents or anywhere in the family, if it has ever been there? Is it something that can occur?
So family history is very, very important in both the lethality and the incidence of prostate cancer. Both for if you have a first degree relative with either ovarian, breast cancer, so on the female side, like if your mother or your sister has breast cancer, ovarian cancer, you are at a higher risk of getting prostate cancer. If your father, your brother, so your first degree relatives also have history of prostate cancer.
Hold Hold up. You said if on the female side, if your mother, your sister, your aunties, if they have the breast cancers or ovarian, and you're a man, you're at high.
You're at high risk of having CA prostate. Because of a gene, there is a gene called BRCA1 and 2. They most commonly implicated in ovarian and breast cancer.
Yeah.
However, because, so if your mother,
and
if I'm a man, I am a man.
okay.
So, and your mom, your sister, have history of either breast or ovarian cancer. So breast and ovarian cancer are related with higher incidence of problems with the BRCA1 or BRCA2 gene. So if your mother or your sister has a problem with that gene, the chances are that you have inherited that gene are high.
Okay.
Now, that gene in men can cause errors in the prostate. In prostate, in the formation and multiplication of prostatic cells. So your chances of getting prostate cancer are higher than the general population.
Right.
But if your father or your brother has prostate cancer, your chances of getting prostate cancer are higher than a person. So this is second degree.
Yeah.
This is first.
Okay.
So a person whose father or brother has history of prostate cancer has a higher incidence and a higher, like the percentage of them getting prostate cancer is high
Than
the
this
general
other
population
person.
and than the person who has history, family history of the mother or the sister having what? Breast cancer.
Okay, and then also does it work the other way around, that if your father or your brother have prostate, as a
No.
as a lady, no, you are not
I
at
did
risk?
find literature on that.
Yeah.
You can't refute anything in medicine, but
Yeah.
I didn't come across any literature on that. Yes.
Now, we cannot talk about cancer and we don't talk about big pharma because it's a whole thing. And I don't know whether it's one, as a doctor, you say, no, you can't talk about them like that, because it feels like all the invasive treatments that come in with the cancers, it's money, it's costly. So has big pharma in anywhere, and I know it's controversial, but has it played a way in especially the rising cases of prostate? Because like I've said, from where I am, I know about 4 people. Some are in the neighborhood, others are within the family, yeah.
So the rising incidence of, actually the incidence of prostate cancer has actually come down. But we are picking it up more in Africa. Why? First and foremost, because we are screening more. So if you look for something, the chances of you finding it are higher than if you're not looking for it. So,
Musawo, don't say it like that, because the one who is hearing you now will not go for an HIV test. I'm telling you. Okay.
but see, the good thing about looking for it, especially looking for it earlier, because if you find it is, prostate cancer is a slow-growing tumor. So it does give you time.
Yeah.
It really does give you time to find it, if it
And
is
fight
there,
it.
and fight it, treat it. If
Okay.
you find it early, you treat it well and good.
Okay.
But if you don't go for screening and it does progress into a more advanced disease, it becomes very hard to treat. The quality of life depreciates. The survivorship also reduces.
Okay.
So,
So screening has risen. Those
screening
cases.
has increased the incidence of, like, we are picking up the tumors more.
Okay.
But the good thing is, if you're picking them up more and you're picking them up at an earlier stage more, it means you're going to treat them faster.
Right.
So even survivorship is going to increase.
Okay.
Then another thing is our life expectancy is also increasing.
Is
Yes.
it?
So if you compare a Ugandan right in this century and a Ugandan in the previous century, the life expectancy has increased.
Okay.
So if your life expectancy is increasing, your exposure to testosterone is increasing. So your chances of getting prostate cancer also increase.
Increase. Okay.
You understand? Then, as with most of the tumors, the other risk factors, or the other things that you're going to find that are causing problems is diet.
Okay.
the westernization of the African diet comes with some issues.
That's an interesting term, the westernization of the African diet.
So
Okay.
what I mean is introduction of fatty foods and all of that. They do increase the chances of developing any almost tumors.
Okay, and of course, as we wrap up, I wanted us to get into that. Any lifestyle changes that a man out there who is watching us this morning can do in order to reduce their chances at beating this?
So the most important thing in the battle of, against cancer is actually knowledge.
Okay.
So the more knowledgeable you are, which is what you're trying to
do. Yeah.
The more knowledgeable you are about these tumors, you know that they occur, you know that they can be treated.
Yes.
It increases your chances of surviving. However, as I said, what we need most, so our diet, Mediterranean diet, so meaning it consisting mostly of like fish, vegetables, and few of the saturated, the fatty foods. Increasing our exercise. So you're going out more, you take a walk, you go for a jog, you go for a swim.
Okay.
That is very, very important. Yes.
All right. Any final advice you can give to the person who is watching us? A tip, advice, anything from a doctor to the person who is watching us today?
So my final remarks today will be health is wealth. I think that is a mantra that is said a lot. And health is the most important thing that you do have. So guard it safely, guard it jealously, and keep on trying to do the best for yourself.
Okay. But the other thing, I'm sorry, before that I've been reminded of is how many times once a doctor diagnoses you, like how many times would you say someone should go for another opinion before, especially before you go under the knife? Because that one, it's irreversible. So how many times do you say someone should get another opinion before they finally settle for any medical procedure?
So, as you have said, before you go under the knife, it is something that is really almost, if it needs to be done, it needs to be done. And especially in the way that medicine is practiced these days, is before anyone does something, most times we want to be as sure as we can.
Okay.
So they're going to do a variety of tests. And that is where we are right now, is you can do a variety of tests. Imaging, you can do the CT, you can do the MRI. And also, before we say that you do have a tumor, I think with that we do is the biopsy.
Okay.
Even with the prostate, you do a biopsy, what we call the 12-core biopsy. So they take off like 12 different samples from different parts of the prostate. Before we do say, this is prostate cancer. So we have to confirm it histologically, and then we see its extent using our imaging, be it CT, be it MRI.
Okay.
Then, once we have said, okay, it is prostate cancer, we have graded it, and then we have said it is localized, that is when the surgeon will say, this is the best time to go in. So before most or all surgeons do go for surgical procedures, they will explain every step to you, and they tell you the benefits and the pros and the cons. This is what you'll get, and these are the things that may occur.
Okay.
Yes. Second opinion is a patient right. That one, there is no one who can stop you from getting a second opinion.
Do you personally encourage it, or do you discourage it?
I tend to encourage, if you have your doctor that you do trust, and he explains to you things in the best way possible,
That you understand.
and you understand, and you're comfortable with him, you can stick with him or her.
I don't know if this applies to doctors, but I know that when you have a personal, say, a personal shopper or a personal dealer in any field whatsoever, let's say if someone is the one who supplies you appliances at home, and there are greater cases or risks for them to sell it to you more expensively than if you went out there to a new person and tried to negotiate all through. So it's kind of the the notion that I always have that when you have this person and you say, I have my doctor, they are the ones who can easily sell to you something that you probably wouldn't need, but for whatever reason, they can easily sell it to you as opposed to a new player.
So I think this comes down to a person.
Okay.
It really comes down to the ethical and the ethics and the morality of a person. That was if we have decided to walk this journey together, especially now journeys of oncology truly are long and they are long and hard.
Yes.
So you have decided, let me walk this journey with this oncologist, with this surgeon. Most times you're going to tell them your history. They're going to know where you started from,
Okay.
the plans they have done, to take away that risk of repetition. But let us do this test again. But we did the test last week, we did the test 2 weeks ago.
Right.
We tried this modality 3 weeks ago, it didn't work. So those are some of the things you think about, or that I think about. However, I do not discourage second opinions.
Yes.
If you do believe that, because going to see another specialist, another person who is invested in this field, and with Uganda, with how few of them they are, they do know themselves.
Right.
So if you move from A to B, and you explain your condition to B, B can always call up and like, hey, I've seen this person, and then because if you have been seeing a specialist in, let me say, Mbarara, and now you have maybe moved to Kampala,
Yes.
and you have to do checks every 2 weeks or every month.
Ideally, you would
Ideally,
need
it would be good to be transferred to a Kampala specialist.
I hear you.
So things like that. So no one, maybe some people do have a problem with it, but if it necessitates the comfort of the patient, there is no harm
You
done.
encourage it. All right. Thank you so much, Dr. Paul. For me, if I'm taking anything from this conversation, is health is wealth. So let's do the best that we can, especially with our lifestyle. Let's start there. The rest, we can always work onto it. But when it comes to our lifestyle, I think that there are certain things, and you really comfort me a lot, Dr. Paul, because you've never said, hey, don't eat any chicken from now on. I like that. I like that. I'm not being, but you tend to just remind us that, you know what, a walk a day can make a difference. Make sure you're eating a vegetable a day. Those small things, sleeping right, drinking water, they're the same things we encourage them. Here, doctor, we tell them, yeah, but they don't hear. We even have a coach here to help us just to keep in shape. But that was the conversation. We hope that someone out there has been able to learn a thing or two. Now, if you have any further questions, use our line. Use the line right on your screen so that you can be able to reach out to us, and then we shall extend those same messages to Dr. Paul. But in case you feel like, you know what, you need to go in and see a doctor, all the way, please go to ADDY Memorial Hospital in Kanyanya along Bahai Road. They are our partners on this journey to help us get better when it comes to our health issues. All things health, ADDY Memorial. So thank you so much for being with us this Wednesday. We say bye and then see you tomorrow.